Hi, I'm Dr. Ellen Hendriksen, and you're listening to Episode 9 of The Savvy Psychologist. I'll help you meet life's challenges with evidence-based research, a sympathetic ear, and zero judgment. We'll use the best of psychology to help you be happy, relaxed, and most importantly, yourself. We're in the home stretch of what some have called the worst winter in U.S. history. Trudging to dig out your car yet again, your temper may match the days. Short, dark, and icy. This episode is for everyone stuck in a polar vortex, by request from Dan H. of Providence, Rhode Island. Now, the winter blahs are pretty common. Some folks hate the holidays. Others feel let down once the Christmas tree is out by the curb. And still others get ground down by month after month of gray skies and grayer slush. And even Wall Street isn't immune. Indeed, the price of IPOs has been found to vary with the season. As we've mentioned on the show before, most disorders are the extreme end of normal experiences. So winter blues is a problem, but a relatively minor one. You feel blah, you eat more Girl Scout cookies in the recliner than usual, but you manage to function. By contrast, seasonal affective disorder, or SAD, is more serious. More often than not, someone suffering from seasonal depression feels like a hibernating bear who's been disturbed, grouchy, lethargic, and exhausted. You may also feel sad, guilty, hopeless, pessimistic, unmotivated, and self-critical. And symptoms that are different from a non-seasonal depression include craving for carbs, resulting weight gain, and sleeping too much. Also, unlike typical depression, which is equal opportunity when it comes to the season, seasonal depression lifts like a hemline once warmer weather hits. Seasonal depression affects 1 to 5% of Americans in the lower 48, with numbers increasing as we move into northern latitudes, shorter days, and longer winters. So in Alaska, numbers can top 10%. Women in their childbearing years are the most affected, with a 4-to-1 ratio of women to men. So what causes seasonal affective disorder? No one is exactly sure, but the shorter daylight hours of winter seem to be the main cause of seasonal depression. Light is the pacemaker to our pacemaker. It cues our circadian rhythms or our internal body clock. Shortened daylight hours can trigger a cascade of problems, so our out-of-whack circadian rhythms throw off associated neurotransmitters and hormones such as serotonin and melatonin, which in turn throws off our appetite, sleep, and mood. Additional factors like climate, genetics, and even the sensitivity of your retinas combine to create the perfect winter storm for seasonal depression. Those carb cravings, by the way, are your body's attempt to boost serotonin. Serotonin release can be influenced by high carbohydrate food, as anyone who's ever reached for a donut to soothe a bad mood can attest. Indeed, it's not just a phenomenon unique to seasonal depression. Ask anyone who's ever tried to quit smoking, had PMS, or battled emotional eating. So what can you do to beat winter blues and seasonal affective disorder? Instead of curling up in a fetal position with a stack of cinnamon rolls until spring, try 5 tips for beating mild winter blues. And if your struggle is with full-blown seasonal affective disorder, listen on for 3 tips on how to combat that too. So first, the winter blues. Tip number 1, see the light. Serotonin production in the brain is related to light. That neurotransmitter gets pumped out more quickly as the days get longer and brighter. Likewise, the production of melatonin, the sleep hormone, is also regulated by light. To treat winter blues with light, getting some winter sun may be enough. But standing indoors by a closed window or seeing light through a windshield while commuting isn't sufficient. But a walk around the neighborhood with your dog, or a trek to a deliberately distant coffee shop during bright midday hours might be a satisfactory, if cold, way to soak in some sunlight. Tip number 2, exercise. A long line of studies touts the benefits of exercise on mood. And how exercise might work in the context of seasonal depression isn't exactly clear. Some studies say exercise somehow increases one's sensitivity to light and can help restore circadian rhythms. Others say it jumpstarts the circadian pacemaker, a cluster of neurons in the pineal gland. Regardless of how it works, a good workout might help you achieve a good mood, despite any impending snowpocalypse. Tip number 3, drink coffee. A huge study followed 51,000 American women for 24 years and found, among many other things, that as coffee consumption went up, risk of depression went down. The women who drank the most coffee, 4 or more cups a day, had the lowest risk of depression. The researchers were careful to say that the research was too preliminary to start recommending caffeine as depression inoculation, but in the dead of winter, the stimulation and warmth of a good latte can't be a bad thing. Tip number 4, wash your hands. This seems an odd way to improve your mood, but you're more susceptible to depressive symptoms after a viral illness, and hand washing is the best way to avoid a cold or flu. Tip number 5, socialize. Social support is one of the best buffers to all kinds of mood problems, but I know, when you have the winter blahs, the last thing you feel like doing is hanging out. So if nothing else, throw a winter doldrums party, wear your best Snuggie, and make your friends come to you. Now, in addition to all of the above, here are 3 extra supercharged tips to battle true seasonal affective disorder. Tip number 1, talk to your doctor about a light box. For seasonal depression sufferers, a light box is the treatment of choice and works for 80% of patients. One study even showed improvements after just 1 hour of treatment, near immediate effect. The consensus is 30 minutes with a high-quality light box when you first wake up. While this can seem like a time suck, it's 30 minutes well spent. Simply sitting in front of the light will trigger a cascade of changes in your brain and reset your body clock. Talk to your doctor about a possible prescription. Tip number 2, negative air ionization. I admit I was skeptical about this one at first, but it checks out. A negative ion is an atom or molecule that has gained an electron. Negative air ions are generated naturally by moving water. There's a higher concentration at waterfalls, the beach, and even in your shower. Summer air, but not winter air, has a high concentration of negative ions. A study in the prestigious American Journal of Psychiatry found that high-density negative air ionization during sleep led to a 50% improvement in seasonal depression symptoms in about half the participants. So not as many as with bright light, but a breakthrough non-drug treatment nonetheless. One thing worth your skepticism is the resulting avalanche of negative air ionization products out there. Bracelets, air purifiers, even light boxes with negative ionization built in. Unfortunately, most negative air ionizers emit too few ions to do anything for your mood. The generators in the study had a flow rate of 450 trillion per second, much higher than most products on the market. But machines that match the ones used in the study are out there. You just have to read the fine print. Tip number 3, consider traditional depression treatments, medication, and therapy. On the medication front, Wellbutrin, which has the reputation for being energizing, has been approved by the FDA for treating seasonal affective disorder. So talk to your general practitioner or psychiatrist about this option. On the therapy front, cognitive behavioral therapy, or CBT, can address the unhelpful beliefs and habits, like withdrawing from a winter social life, that may go along with seasonal depression and may act as inoculation for future winters. Find a qualified psychologist you like and trust. So there we have it, 8 tips to beat the winter blahs and the more serious seasonal affective disorder. Snowmageddon will be no match for you. Thanks for listening. I'm Dr. Ellen Hendriksen. For a happier, healthier mind throughout the week, head over to the Savvy Psychologist Facebook page or Google+. And a transcript of the podcast and references for the studies I mention are always available on quickanddirtytips.com. That's all for this week. A final note. Remember, the Savvy Psychologist is strictly for informational purposes and does not substitute for psychiatric care or psychotherapy by a licensed professional. As always, any patient names have been changed and details altered to protect privacy. Thanks for listening, and see you next week for a happier, healthier mind.